Dr. Khan, welcome.
Good afternoon.
All right. I would like to thank everyone for being here today, and particularly our special guest, our chair of TriFaith Initiative, Dr. Ali Khan. And you're in a new setting today, Dr. Khan. Where are we talking to you from?
You're talking to me from my office this afternoon. It's been a very early morning. I started out with a new day at CNN, and one meeting just fed into another meeting, and I haven't had time to get to my office this morning.
Well, we're glad you're with us now. Thank you very much. We're very excited to hear about you personally and professionally. And for those who may not know, although I know he is a legend, Dr. Khan was the director of the CDC Office of Public Health Preparedness and Response, and is currently the dean of UNMC's School of Public Health. He is the author of the book, The Next Pandemic, which is fascinating that is the person who we're able to have as a guest and a leader with us here today. And as I mentioned before, the chair of the TriFaith Initiative. So I think what might be a great soft start for us is for you to tell us about what's a typical day in the life of Dr. Ali Khan.
Thanks, Wendy. I think, and thank you everybody for joining us this afternoon. So a typical day in the life of Ali Khan has changed. I'm sure it has changed for everybody on this phone call, a Zoom call. So what has happened with the pandemic is my typical day, which has always been fabulous. I tell people I have the greatest job in America. I'm dean of your College of Public Health here at the University of Nebraska Medical Center, and we have a great mission, making Nebraska the healthiest state in the union. And as we think about that in the US and worldwide, but when there's a pandemic, you sort of layer all of those response activities on top of your day job. So my day job nowadays is sort of continuing to work with our students, our faculty and staff on what we're doing within the community around public health, but also now in addition, these additional responsibilities to respond to the pandemic that are independent of what the college is doing, but the request that I'm independently getting to provide consultation at the local level, at the national level, and at the international level for advice on what is the right things to do around contact tracing, healthcare preparedness, and sundry of other issues that come up around vaccine development, for example, reopening businesses, reopening various other institutions. So that's what my typical day starts like. So there's various interviews of various businesses I speak with, and then it's what you see here, a whole lot of Zoom calls, one after another. My version of, I've been told, either the Brady Bunch or Hollywood Squares that I see all day, that I see pretty much all day long, early in the morning until late at night.
Yeah. So let's go back to your personal story. And I know you were born in Brooklyn of Pakistani immigrant parents. And I'm wondering if you can share some information about your family's culture and perhaps religion, as you know, to the point that you feel comfortable.
Absolutely glad to. I mean, my whole life is defined by that story, to be very honest with you. So my dad was, 14, 15 years old, peasant farmer up in Kashmir. Well, I guess back, this was pre-partition in India, Pakistan, in those days in the subcontinent. And he made his way down multi-day journey from the northern part of that country up by the Chinese border down to Mumbai. Bombay at that point, lied about his age. He's a little skinny, scrawny kid from what he told me. Said he was 16 years old and started working in an engine room as a greaser boy, running around sort of doing odd chores for the individuals on a ship. And that's how his life started, with hard work. And pretty much right after the World War, He jumped ship, so my dad was an undocumented alien in San Francisco right after the war, and made his way to New York City. And fortunately came across wonderful people who helped him out. His initial work ethic. So I should have said we were Muslim. He was Muslim. Probably it's hard to tell from our history, but my guess would be 3 or 4 generations or 5 generations Muslims. Before then, probably Hindu would be my guess, or agnostics or atheists would be how long our family had been Muslims. Our history doesn't go back that far, but came to Brooklyn, New York City, and his first job, some of you on this call will remember before we had these wonderful little digital thermostats. My dad used to get up way before the sun started shining on his little bicycle, and he would shovel coal into boilers so that when people woke up, they had hot water and steam. And I hope I see some nodding heads for people who remember coal boilers and burners. And then in the afternoon, before you came back home from a long day at work, he would make sure that he had stoked those boilers, and you came back to hot water and steam again in the afternoon. So that was my dad, and that's what he did. And he had a wonderful friend, Mr. Rosenberg, who said, Deanie, my dad's nickname was Deanie, Glob Dean. He said, Deanie, you're never going to get anywhere stoking boilers your whole life. And he gave my dad a little stake to help buy a small house, a multifamily house. And based on that, he bought his first little house. And then he made his, from what I can tell, over the course of his lifetime, made and lost his fortune probably 2 or 3 times with real estate deals in New York City. And that was the setting in which so that was sort of what has gave me that ethic of hard work my whole life. So that's sort of my story of how I grew up in Brooklyn.
I know you traveled internationally to have kind of a cultural experience. They talked about that a little bit in that the New Yorker. Yes. So tell us a little bit about your high school years.
I will be glad to tell you a little bit about my high school year. So I went to PS 130, Brooklyn, New York, right down the street from where we lived on this humongous highway, Ocean Parkway. And my dad thought that, you know, these kids are growing up. And so we had a very large Muslim, essentially Pakistani community around us. But he thought, you know, this kid's growing up. He knows very little about his religion. He knows nothing about his language. My parents spoke English. I have no idea why, but they mainly spoke English at home. And needless to say, I spoke English with all my friends. So he thought, you know, this kid needs to learn some religion, a little bit more about his religion. He needs to learn a little bit more about his language. And so he packed all of us 4 kids up and said, all right, I'm going to send you to private boarding schools in Pakistan. And so he sent us, both brothers and both sisters at that point to the 2 premier private boarding schools in the whole country. One tiny little mistake. So we went to the boys went to Aitchison College, which was a British boarding school, English medium. Okay, so everything was taught in English, and everybody in the school were people like us. There were a bunch of expats from all over the world whose fathers and mothers had the exact same idea that my dad did. So none of them spoke Urdu either, right? And knew very little about their religion. So I came back out of high school speaking no Urdu and having learned very little to nothing about my religion. So yes, you know, I took everybody, you know, some of the local domestic students obviously took the regular Urdu classes. For those of us who came from abroad, we had sort of this Urdu, they had a name for it. Essentially, English for, what do we call it? English for secondary, help me with that. What's the term?
English as a second language.
Yes, they had Urdu as a second language, yes. So for all of us, we went to these English as a second language classes, and we never progressed out of that for like the 3-4 years we were there. So I can order in a restaurant pretty well. You know, I can pretty much get my way through a restaurant if I had to in Pakistan when I go. But that's the extent of my Urdu skills. And I can pray. So, you know, I know enough about, I know the principles of my language. I'm probably more spiritual than I am informed about the deep theology of Islam at this point. And then the same thing was true. My sisters went to St. Mary's, which was a Catholic boarding school in Lahore. So that's where my sisters went to school, also English medium. So it was an interesting exercise of how you try to teach your children about their religion and their language coming back. Fortunately, my sisters were a lot more savvier than the boys were. They actually came back very fluent in English and very fluent in religion and theology than we were. But from a religious standpoint, so we have a strong culture, or at least, you know, so I sort of try to tease out some of these theological, religious issues and cultural issues. So for example, I have fasted since I've been 12 years old, right? And that's always been very important for me, continues to be important for me. So we just completed, you know, the month of Ramadan right now, and Eid was on Sunday for us here in Omaha. So those are some sort of religious cultural customs that we have maintained. Zakat is something that we, you know, hold very dear to our hearts and make sure that we support the tithing or the tax that we pay every year from our wealth. 2.5% of everything we own every year has to be paid out into our community. So those are sort of customs that we were taught by our parent and our grandparents that we sort of have all maintained. All of the children have maintained, and now my children were, when my kids were growing up, they fasted with me growing up. So they grew, you know, it's sort of accustomed to get up in the morning, every morning, and do this. And during the month of Ramadan, they would all sit and look at the list of where we're going to send zakat money. And so they would make that common decision as a family of this is where the money was going to go for zakat. And I'm hoping that as they raise their children, they will do the same thing, you know, make a decision as a family of, you know, getting up in the morning to pray and fast, and making a decision as a family of where they're going to give zakat. So those are sort of some of the cultural, spiritual, religious themes that flow through my family, Wendy. Thank
you. So who and why got you to come to Omaha after all the global experiences? It was my next question, but it just got posed in the chat as well. So
let me tell you who did not get me to come to Omaha, and that was not Karen Levine. So she was the person who if up there in the box top right, if you had left it to her, I never would have come to Omaha. Okay, so it was Dr. Hal Moore. So I had a wonderful time at CDC. So I'm an accidental public health practitioner. I'll be very honest with you, right? My dad had a 5th grade education, generously, 6th grade, brilliant man, absolutely brilliant man, but not schooled, right? But he knew schooling was important, and all of his kids have completed at least a master's degree, and I think many of us have probably doctorate degrees at this point. So he knew education was important, and he made the appropriate sacrifices to make sure that all of us were educated. So I knew at 16 that I wanted to go to med school, and I wanted to do infectious diseases. I've always known that, and I've had wonderful, wonderful mentors all the way who have helped me. So when I was at University of Michigan, I had a wonderful mentor who said, Ali, and he had set me up for an infectious disease fellowship in Boston, back near New York, which was home. But he said, before you go back to do your ID fellowship, why don't you go to CDC for 2 years to do this disease detective thing? And I said to him, CDC, how do you spell it? And he said, do not embarrass me. So my 2 years became 23 years. I love CDC, an amazing place. one of the few places I think I will ever work at where everybody you work with is smarter than you are, right? It's just a wonderful place to work at. But I completed 23 years at CDC, and it was time, truly time to do something else at that point. Still love the agency, will always love the agency. And again, great mentors who said, Ali, you've already teaching at Emory, time to think about being a dean. And these mentors started to send me opportunities to be deans in either colleges of medicine or colleges of public health across the US. And many of the places I went to, and I know that I see a number of people in academia here on my sort of Hollywood Squares boxes in academia, they were more competitive than collaborative and cooperative, even like within departments, let alone across campuses, right? And that was just, after working at CDC, that wasn't the environment I wanted to go into. So one of my mentors said, Ali, why don't you go out to the University of Nebraska? And I'm like, University of Nebraska? I'm sorry, New Yorker. So came out to the University of Nebraska Medical Center, and some things were very clear right away. And I need to give kudos to Dr. Hal Moore, who was the chancellor at that point of the university, one of the individuals who helped recruit me. And what was very clear right away was the community here. And first, at the level of the university, very collaborative. Everybody will, even if there's no way to work together, people will at least start with that as the starting point, which is, how can I help? How could we potentially work together? And that's just a great place to work. And you also, you just drive by 42nd Street. I mean, the best analogy I can use is mushrooms. I mean, the place, there's something popping up all the time on that campus. I mean, this community is so generous to the Med Center and the intellectual capital there and what's happening there. So it's, once I tell people now that I'm in the business of recruiting to the medical center, I may not be able to get you to come to Nebraska, but once I get you to Omaha, it's easy to get you to stay. I just need to get you here one time. And especially if you have a family and kids to raise, then it's almost slam dunk. If you have kids to raise, it's I can pretty much get you to come and stay here and recruit you here. So Dr. Moore was really critical in saying that this would be a great place for you, Ali, to work and build a college of public health.
Thank you.
My passion at that point was, how do you take public health and healthcare and put that together? Because as you know, and this COVID-19 outbreak is a great example of that we have some of the best healthcare in America, but only if you can afford it, right? And so we still have, 10% of Americans without access to healthcare in America. And even in those who have access do not necessarily have access to the best quality healthcare. So my passion was sort of putting that back together again. And when I came here, it was very clear that would be easy to work with the College of Medicine, College of Dentistry, College of Nursing. It would be easy to work with the clinical enterprise. And that has proven so true here. And when I came, Dr. Moore was transitioning out to Dr. Gold, and Dr. Gold had that exact same attitude as he told me to, because that was the transition. And he said the same thing. He said, Ali, without a doubt, we will support you if you come to work across campus and make these things happen. So that's, Wendy, how I got here. But wait, no, I don't want to finish with Karen Levine. So let me tell you what Karen told me. And Karen, you're going to get busted on this one. So when I came here, so Karen's supposed to be recruiting me because Karen was the development officer for the College of Public Health out of the foundation. And Karen goes, I'm just going to be honest with you, Ali. You have no endowment. You have no endowed professorships. What else did you tell me I didn't have, Karen, as I was trying to lead a new College of Public Health? So she was very frank about all the no's that the college didn't have as we were trying. And needless to say, Karen was instrumental in helping change a lot of those no's to yes. as the community has been instrumental in changing a lot of those no's to yes. So we have gotten, through the generosity of the community, we now have a couple of endowed professorships. We have a couple of endowed chairs currently within the college, and we'll be looking for additional support because that's so critical for us to hire people to have these endowed positions. We've run out of space. We're hoping soon to be able to have additional support to be able to put up some more space for people once we're allowed to bring people back onto campus again. But that part you were right about, Karen. This is a very generous community. So that turned out to be true too.
Thank you. So I want to ask an answer and ask for kind of a quick response to it, because we have a lot of questions about COVID. So we're gonna get to those questions, but you know, you can hear him talk about that on CNN or NPR or all day long. So we're gonna answer some of those questions, but I want you to tell us why TriFaith.
Oh, why not TriFaith? Oh, that you want a quick answer to why TriFaith? How can you get a quick answer to an entity that says they're all about celebrating differences? I mean, you're essentially distilling the whole story of my family's generation's life into a motto, right? Of the celebrating the differences. TriFaith is about religious differences, but all of the differences that define us and make us so wonderful and that make America so wonderful, is TriFaith. I mean, and I love the fact that that is what is TriFaith, and it's about choices. And anybody who ever speaks to me, I talk about it in public health and I talk about it in healthcare. It's about the stories we tell each other, and it's about the choices we make, right? And it's so many of things that we think are accepted. It's a choice we make, right? And we make a choice when we look at somebody else to say, you are the other, or no, you're just like me. That is a choice, right? And TriFaith says that when you look at somebody else, who in TriFaith's case is a different religion, as a different faith profile, you make that choice to either say, oh, you are the other, or you make that choice to say, I'm going to embrace you because you're another fellow human being. And hey, cool, let's talk about what the differences are, because I learn a little bit something new about the world through you. And so that's why TriFaith for me every time.
And can you tell us again, like, I think that framed it, but as chair, what is your vision for the next 3 or 5 years for TriFaith?
Oh, so my vision is the board's vision and the vision of the 3 congregations that we represent. So I'm not sure if I have an independent vision of the board and 3 congregations, 3 amazing congregations that came together and said, we're going to build something that hasn't been done before, right? And not only were they going to build something that hasn't been done before, they did it. So how many organizations actually get to go tick on the mission statement, right? They have come together and purposely built a campus with 3 separate faith organizations, purposely built with their 3 buildings, and hopefully soon, thanks to many generous people in this on this little board here who have supported us, we will have the 4th building, the TriFaith Center, up soon enough. Right, Wendy?
Right on.
Right on, right? So this organization is going to hit the tick box for purposely built campus, right? And so the next 5 to 10 years is, how does this purposely built campus, as they show a lived experience of these 3 congregations, show how are you an inspiration, not just here in Omaha, for how you do this in Omaha, but how do you do this in Nebraska? How do you do this in the region, the nation, and worldwide, right? And I love when I talk about TriFaith, for those of you who have seen me in other settings, I talk about TriFaith everywhere, right? And people go, you're from Nebraska? And I go, you're right, I'm from Nebraska, and we're doing this in Nebraska, right? And if we can do this in Nebraska, we can do this anywhere. And I want this to be an inspiration everywhere, because it's about choices, and you can make that choice no matter where you are in the world, to embrace somebody else and embrace those differences in somebody else, and think about that religious pluralism a completely different way.
Thank you. So we're going to switch now to some questions about COVID and the response.
Okay.
Thank you for your passion and for your leadership and for your friendship on all things TriFaith. So hard for me to put that aside, but this other stuff seems to be really important.
Okay.
So you've been quoted as saying that the US response to COVID-19 lacks imagination. Can you tell us what you mean by that, and can you relay that specifically to Nebraska?
So let me relate it in two different phases, Wendy. So there's the initial response to the outbreak, and there is no doubt from the initial response to the outbreak that it was not timely and robust compared to other countries that were already responding to the outbreak. So it's always good to remind Americans that there's the rest of the world out there. And we were not the first to see COVID-19, right? So Asia had already seen it, and we saw what the Chinese were already doing. The Europeans were already seeing it, and by 2 weeks, we already knew what the potential devastation was because we were seeing what was happening in Lombardy and in Spain. So we had a heads up on what the response should look like. And we also saw, for example, South Korea, their first case was the same day as ours. They took a completely different response. And maybe it's because they were closer to China. Maybe it's because they had a little bit more experience with MERS, which is a related coronavirus. But essentially what they did is they said, we are going to maintain a containment strategy, which is we're going to find every case, we're going to find every contact. And they massively ramped up testing, and they did exactly that. And so South Korea has had a very mild number of cases, and they now skirt on, 4 or 5 cases a day. We did not take that approach, and it took us 47 days until we basically had a test available in the United States. And at that point, we realized that the CDC test was inadequate, and the FDA said, okay, everybody, all labs, just produce your own test, right? And even today, we are unable to produce what's likely 400 to 900 tests a day that we need to do. So so that was phase one, was not robust enough, was not timely enough. But I don't, let that be bygones. But even today, Wendy, we have 20,000 cases a day in the US. So this is 6 weeks after we've peaked. And if you look at the rest of the world that preceded us, so even cases in Europe countries in Europe that had as a high of an attack rate, as many cases per million as we did, they have markedly decreased their cases. We have not done that. So I said this morning, we are essentially writing 100 to 200 death certificates a day right now.
In what time period?
Daily, every day, 20,000 cases, 100 to 200 death certificates we're writing every day for these people that are diagnosed today.
So would you go to the gym?
So this is all about shared responsibility to me, okay? So shared responsibility means 2 pieces. There's our piece, so each individual piece. So if you're sick, please stay home. And if you do want to go out, wear a mask without a doubt. And I'm sure people have mask questions. We can go over that. Wear a mask, wash your hands, social distance. But there's also the responsibility of our elected leaders, which is get community transmission down in your community. And that is the most important piece of the whole puzzle. And you will notice that even in our community, there is no sort of dial or indicator of, do we have substantial transmission in our community? Do we have moderate transmission in our community? Or do we have low-level transmission in our community? So, and without picking on our community or on our state, I have been telling everybody everywhere in the US that you need to hold your elected officials accountable for how much transmission there is in your community. And I would be cautious wherever you go in the community until you look at your numbers and you see cases are low in your community. So that's my answer to Would I go to the gym? Would I go to the nail salon? Would I go to the massage parlor? When I see cases are really going down in Omaha, I will say I feel a lot more comfortable going to those places. So I'm still doing takeout myself right now.
So the mayor sent a letter to employees today saying that working at home ends starting Monday. Is it safe for our city employees to go back to work?
So our university will allow people to come back to work on Monday. We are still recommending that if you can, in conjunction with your supervisor, that if you can work at home, you continue to work at home. And that's going to be my recommendation to my employees, which is if you can work at home, continue to work at home for as long as you can. And if you need to bounce into the office to do something, sure, bounce into the office to do something, wear a mask, wash your hands, socially distance. But until we really see a market decline of cases in our community and we can say we have low-level community transmission, stay at home. Similarly, I have a 93-year-old godmom who lives here in the community with me. I still bring her groceries, and I will continue to bring her groceries and not, let her go down the street to Hy-Vee to go pick them up herself until I see low-level community transmission.
And asking for a friend, but dinner in the backyard with friends?
But I feel a lot more comfortable about outdoor activities than I feel about indoor activities, to be honest with you. So viruses do a lot better outside than they do inside. They dissipate a lot faster. So outdoor activities, I feel a lot better. And it's also around demographics. So if you look, most of the outbreak in Omaha is in South Omaha. It's predominantly amongst the Hispanic population. So there are niches of where there's more disease and less disease. And if you're in a community or a group of friends where nobody seems to be sick, you're likely better off amongst that cluster of people than if there are people who do have disease. But that's an individual risk assessment for individuals to make themselves, right?
So you just spoke to COVID puts a spotlight on the inequities and racism that exists in our community, in our country, in our world. I'm particularly interested, we're having some conversations with faith community leaders about what we can do, but what can academia do to impact this reality?
And what is academia doing to help impact this reality? So I know the University of Nebraska Medical Center, we have gone out to many of these facilities, the meat processing facilities, to work with them and their employees to think about how they can work safer. And these employers have been very responsive to that, and we provided them checklists to help them do that, including administrative changes about paid sick leave and other elements to make it easier for employees to take time off, increase testing. But the second piece of that is linking back to the community, and how do you make sure that you have good connections back to the community to decrease transmission within the community. So yes, there is a role for academia in this, not just colleges of public health, but colleges of social work, etc., to work with them, and obviously for the faith community, because a lot of these individuals are linked tightly to the faith community.
Nasser, does that completely answer your question, or you could unmute yourself and perhaps add on to the question?
Thank you. My question was more related to the inequity in terms of the infections, especially with minority populations. And I know your department have done some work with health disparities in North Omaha and so on. So what is being done specifically for COVID-19, especially with the larger number of infections with African Americans and other minorities? Thank you.
Hold on, let me. Nasser, great question. So our Center for Reducing Health Disparities and our Associate Dean for Community Practice have been working, for example, in, I know the best example because we had this conversation a couple of days ago, Grand Island, where they have had a recent outbreak around meat packing plants, and they've brought in a lot of the community to have a conversation with the leaders within that community of how they can address the issues that they were having. So there are conversations, and we're helping sponsor those conversations within the community to try to decrease their risk. I'm trying to look up your numbers for Douglas County.
So related to that, Jim Corson's asking about the incubation period for the virus. Are the numbers we see on the news, such as cases and hospitalizations, actually indications of what happened 2 weeks ago? Are they indications of a more current?
So the number of positives are usually people who are already sick. So what that tells you is that they likely got infected somewhere between 6 to 14 days ago. So it tells you it's a glimpse through a rear view mirror of when people were getting infected. And the same thing's true for deaths. So if you're looking at deaths, the actions that got people that led to their death unfortunately happened 2 weeks ago. Right, so some states report the date of onset, which is usually the most important for us epidemiologists and public health practitioners, because that really gives you a sense of what was happening. That gives you a better sense of what was happening when people were infected. So you really have to sort of line up when was the sample from when they died, when did they get sick, and when did they get infected. So all those timelines need to sort of be cleaned up to really get the best sense of what's happening within the community.
Can you tell us about your relationship with the governor? And is he listening to you at all? And between governors, between the states, what suggestions you have for us to help amplify a voice that might be different than his? That may be like 6 questions in there.
Yeah, that's 6 questions. So we are very fortunate that the governor is data driven and he talks to lots of people. So that's really a wonderful thing about Governor Ricketts. And he doesn't just speak to me, he actually speaks to numerous people, business people, public health people. He gets lots of advice from numerous people, and he integrates it into his decisions that he finally makes, recognizing, as you all recognize, he has to make a political decision at the end of the day, and political decisions integrate not just the science and not just the science, but other issues. And what you can all do is, I think, hold the governor accountable for the number of cases within the community, right? So I keep trying to remind people, this is not flu, right? If just look at the numbers from China, South Korea, New Zealand, we can get cases down within the community. And the best way to protect people within the community, allow the vulnerable population back out into the community, is drop cases in the community. And that's where everybody has a role on this Zoom call, is your advocacy to say, what's our public health departments doing, right? Do they have the contact tracers? Do they have the epidemiologists? Do they have the risk communicators? Where's the, billions of dollars that came to the state? Are they being put into public health to drive down cases within the community?
So there's so many numbers to look at. Is there a particular number? I mean, on yesterday's call, you said you really only care about if there's substantial or low or none in terms of outbreak. But when we're watching the news and we're making our choices about whether or not we're ready to go out, is there a particular source or there's, when I go to the Douglas County site, there's 6 pages with 6 graphs on each page. It's a little overwhelming for someone without your credentials to know exactly which indicator to pay most attention to.
So I would start, so the first indicator people should pay attention to is number of positive tests. So how many people are infected, since that's what Douglas County shows. And the reason I have been a little distracted for the last 20 seconds is, if I am correct, it looks like there were 273 positives in Douglas County yesterday, which would be the highest it's ever been. That would be disturbing if it's really 200, because I thought we had been past the peak of 200, but if it's really 273, then then there are increasing cases going on in Douglas County. So you are actually still peaking in terms of people getting sick in your county. That would be disturbing. Okay, so yeah, look at the number of cases. Then once you look at the number of cases, the next thing I always look at is percent positive daily, because one reason cases can go up is because you're testing more and more people. So you want to make sure that the percent positive daily is staying below 10% or so. So those are the numbers I look at, is how many people are sick today and how many tests did we do. So that's generally what I look at on a daily basis. But that would be the curve. If you go to Douglas County, just look at how many positives they had today. And if over time, if that doesn't start coming down, just the number of positives, if that's a simplistic way, that's not good. And that'll factor in everything else.
So some states have hired contract tracers to support the effort to contain the virus. And what's being done for that in Nebraska or in our county?
So we're tangentially involved in that. And I think the college may be helping the state do that, but the state has engaged a number of third parties to do contact tracing via phone calls, and they have asked many state employees that were staying at home to do some contact tracing. So I believe there's sort of a myriad of different methods to try to help do some of the contact tracing.
And related to Test Nebraska, can you maybe just give us a little insight on that? Lisa's specific question is, I had a Test Nebraska test on May 21st, showed I did not have COVID on May 21st, but who knows about May 28th? What's the advantage of Test Nebraska? And does it seem to be carte blanche for people who test negative to violate the rules?
Yeah, that is an excellent, I don't know who asked that question, but that's an excellent question. If you don't have symptoms, Test Nebraska doesn't help you, right? If you're negative today, it doesn't mean you can't be positive tomorrow. So the reason to get tested is if you think you're sick, to see whether or not you're infected or not. And if you're infected, then you need to be isolated, and then we need to find your contacts so they can be quarantined. So a negative test, if you're asymptomatic, doesn't really mean anything. So the purpose for Test Nebraska should be to find people who are sick early so they can be isolated.
We have a question here asking how to address those who believe this is a hoax.
There's 100,000 dead people. Probably another 30 to 50,000 who are uncounted yet. So it's kind of hard to put this across as a hoax, unfortunately. It's a significant tragedy, I would say.
Yeah. Let's see if I can find, can you outline a road to a vaccine?
Glad to. Before I outline a road to a vaccine, you're going to get my major theme again, which is numerous Asian and European countries are reopening with very few cases without a vaccine, okay? So do not be distracted by vaccine conversations. Do not be distracted by mask conversations. Hold your leaders accountable for dropping cases in your community, okay? Hold them accountable. That's their job, the risk reduction piece. Okay, vaccines. So there are 100 vaccine candidates. There are 10 vaccines worldwide that have gone into people's arms. The vaccines that have gone into people's arms have gone into what are called phase 1 and phase 2. So phase 1 and phase 2 basically are designed to make sure that when somebody puts the vaccine in your arm, you don't keel over, right? So it's, are they safe? Do they cause any bad reactions? what is the immune response when we test some blood. That's all phase 1 and phase 2 studies do, right? So there are a handful, a couple hundred people. And so when these vaccines succeed through phase 1 and 2, somewhere in the fall, some of these vaccines would go into phase 3 trials, which is the ones we all care about, which is you put it in thousands of people and see whether or not they get infected or not. And then from that, you get the winners, and then you would make millions of doses of the winners to give out to people. In the best case scenario, you know, Dr. Fauci says he thinks we could have something available by sometime in January. That would be the most optimistic rose-colored glasses view I've ever seen. I will tell you, as a public health practitioner in this business for a very long time, I have been waiting 18 months for the last 30 years for the HIV vaccine, right? Yeah, it would be fabulous if we had a vaccine, needless to say. I would not pin too many hopes on a vaccine. I'm glad, you know, there's multiple candidates. I'm glad we're putting lots of resources behind this, but there's no guarantees. This is high-risk science by every definition.
Can you tell us about the science behind the antibody tests and when those might be available, and if we should trust them once? What do we have to gain by that information?
Glad to talk about the science behind the antibody test. So there's 2 types of major tests. One test tests whether you are infected right now, this very minute, right? And those are usually the swab up the nose test. Those are called PCR tests. That's the Test Nebraska stuff. The other test is to see whether you've been ever infected. Those tests are good for public health purposes to get a sense of how many within the community were infected. They have really very little purpose right now at an individual level. And CDC just had a new publication 2 days ago that said you can't use that test for any decision making. So you can't use that test to say, hi, I'm immune. Don't do that. So, you know, a healthcare worker can't take that test and say, oh, I'm immune, I don't need to wear PPE anymore, okay? You as an individual should not take that test and say, oh, it looks like I'm immune, I don't need to wear a mask, I can go do whatever I want to do. CDC has said, do not use that test to say, oh, everybody who looks like they're positive, I'm going to put them in a dormitory together, right? So pretty much the antibody tests are really for public health purposes at this point. The hope is as they get better, they will tell us something about immunity, but right now they're not designed that way. They will tell you that probably you were infected, but how long that lasts, how long immunity lasts, or whether that specific antibody that's being tested is a good measure of immunity, that's not so true right now. So really, they're really good for public health purposes right now.
And in terms of just measuring our response, the question that was previously asked about returning to work and choices around that, if your work is requiring a doctor's note and you find yourself within a vulnerable bracket of sorts, what thoughts do you have for conversations with employers or addressing that reality?
So if what I just saw, if what I just saw is that Douglas County had 273 cases today, and so we are spiking in cases, I don't think that's a very difficult conversation to have with your employer, that we have uncontrolled substantial transmission within the community. And based on any set of criteria, that is not when you would allow vulnerable populations out within the community. I also believe that the request has been that you do not need a doctor's note, because you would be overwhelming healthcare systems by trying to go get doctor's notes. So that you should just be able to tell your employer that I'm a vulnerable group and I do not need to come in. But again, that's a conversation between you and your employer, Wendy.
My employer's you, so I'm in a good place.
Okay. Oh wait, and I'm a doctor too.
Great, we're all good. We have a few more questions We'll kind of back up to 30,000 feet here for these last couple of questions.
Okay, I'll try to be quick. Go ahead.
What lessons do you have for us as a community and for humanity at large? Are there lessons to be learned from this unfortunate and devastating pandemic? I had written, is there a silver lining? But Nasser asked a similar question.
There is a silver lining. So there is a silver lining. If you can have a silver lining to a tragic 100,000 deaths, and this is not the big one, right? This is not and I hate to say this, people, this is not the 1918 influenza pandemic. Right, that was 750,000 deaths in 1918. Right, this is 100,000 deaths in 2020. Right, so this is a magnitude off. And look at what happened to our public health, healthcare, economic, political system. So hopefully, if there's ever a pandemic influenza outbreak with a new pandemic influenza virus, we will be more prepared. And hopefully, never again will state and national leaders not make sure we have strong public health systems in America. Hopefully we will address issues of making sure we have health care for everybody. Hopefully we will address issues of making sure we have sick leave for everybody. So I know I am one of the rose-colored glasses people. I know who I am, but I hope we have a better normal as opposed to just a new normal.
And then for this audience who might not know some of the work that we're doing, can you wind together your role as TriFaith chair and your role as a public health thought leader? What role do religious organizations and congregations such as the three at the TriFaith Initiative play in addressing the coronavirus and healing in the community after?
Oh, for those of you who don't follow me on Twitter, it's UNMC underscore Dr. Khan. And I think I may have mentioned this a couple of days ago around TriFaith, that I believe faith, spirituality is actually critical. I said it's not just essential. I think it's critical, more so today than ever before with COVID. And I believe that's how the work that we do in TriFaith and the other spiritual communities here in Omaha and across the US, their role to play during this time is more critical than I believe it ever has been within America as we think about how do we heal from what has happened within COVID. And I don't want to limit it just to COVID. This is a critical time in our history. This morning, my time on CNN was cut short, and some of you may have seen what's going on in Minneapolis right now. There's a number of fault lines in America that seem to be sort of coalescing, tragically coalescing right now. And faith may be one of those things that may allow us to heal some of these fault lines. So please think about that and how faith and spirituality and belief in God. I see Rabbi Israel there, and I cannot let any conference call end without at least saying God once, Rabbi, can help us during this time. I think America and we all need it more than ever.
Thank you. So thank you so much for all that you have added to our work and to knowledge that you shared with us today. I think it feels appropriate for me, to me, if we could collectively just take a moment of silence to end this, to remember all those who are vulnerable, those who need healing, and those who are working hard to keep open our essential businesses and our medical care providers, as well as our elected officials and experts who are hopefully guided by great wisdom in their leadership. So let's take a moment of silence. Thank you. May you have many blessings around the rest of your day. Thank you for joining us.
Thank you, everybody.
Thank you.